What challenges does informed consent face in euthanasia? Imagine making a decision about your own life when you're in pain or feeling overwhelmed. That's what happens in euthanasia cases, but making sure someone truly understands what they're agreeing to is not always simple. Informed consent is supposed to mean that patients know all the risks, benefits, and alternatives before agreeing to a procedure. But in euthanasia, several hurdles make this difficult. First, many patients considering euthanasia are seriously ill. Conditions like advanced dementia or severe pain can impair their ability to think clearly or understand complex information. If someone cannot fully grasp what ending their life entails, can their consent really be called informed? This is a big question in bioethics and applied ethics. Second, even if a patient is deemed competent, outside influences can sway their decision. Family members, caregivers, or societal attitudes might pressure someone to choose euthanasia, even if it's not what they truly want. Sometimes patients feel they are a burden or fear disappointing loved ones, which can cloud their judgment. This raises ethical concerns about whether their decision is genuinely voluntary. Third, communication plays a key role. Euthanasia involves complex legal, medical, and moral issues. Patients need to understand their diagnosis, prognosis, and the legal implications of their choice. If doctors or counselors do not explain things clearly, or if information is incomplete, patients might make decisions based on misunderstandings. Vulnerable groups such as the elderly, people with disabilities, or those with mental illnesses face even greater risks. They might be more susceptible to coercion or feel pressured to end their lives. While laws often include safeguards like psychological evaluations or waiting periods, these measures are not foolproof. The risk of someone being pushed into euthanasia when they are not fully capable remains a serious concern. At the end of life, emotions like depression or despair can also influence decisions. Patients might want to end suffering but may not be in the best state of mind to give fully informed consent. Healthcare providers must carefully assess whether a patient's wish to die is driven by temporary feelings or genuine long-term desire. In countries where euthanasia is legal, strict protocols are in place. These often include multiple consultations, psychological assessments, and waiting periods. Yet, even with these rules, some cases still raise questions about whether consent was truly informed and voluntary. From an ethical point of view, respecting patient autonomy is vital. But these challenges show that in practice, ensuring that consent is fully informed is complicated. Some ethicists argue that the risks of coercion or misunderstanding might outweigh the benefits of legal euthanasia. Others believe that with strong safeguards, respecting individual choice remains possible. In the end, the difficulty of guaranteeing genuine informed consent in euthanasia reflects broader societal debates about morality, autonomy, and the role of medicine. It's a complex issue that continues to challenge both law and ethics, reminding us that even the most well-intentioned policies must be carefully scrutinized.